Hello friends, this is Dr. Ashish Panchal, HOD Pharmacology Department in LJ Institute of Pharmacy. Today we are going to learn principle of cell injury and the adaptation. So, what is cell injury and how once the cell get damaged, how the cell get regenerate, that will be discussed here. So first of all, I would like to teach you that basic terminology regarding the pathophysiology. Patho. What is patho? So patho means it's a suffering, abnormality, and the disease. Logos means the study. So the pathology means the study of disease is known as the pathology. And the physiology, so we all know that the physiology is the normal function of the organ body. So pathophysiology means the study of the normal functioning, okay, during the disease condition, that is known as the pathophysiology. Means simply, patho means disease, logos means study, pathology means study of disease, physiology means functions, and pathophysiology means the study of functions during the disease state, during the abnormal condition of the organ. Clear? Now the next point is the various terminology of pathophysiology. For example, first, morphology. Morphology means it is the visual examination of the disease. Morphology matlab it's simply the outer character, their shape, their color, their location. These all are including in the morphology. Okay. Then second point is etiology. Etiology means the causative factor which is responsible for the lesions, causative factor which is responsible for the disease. That is called the etiology. Pathogenesis. Now for an example, etiology, if the person suffering from the cardiac disorder, then the etiological factor means high fatty diet, then it may be hypertension, okay, then it may be stress. These are the etiological factor. Pathogenesis, the mechanism by which the lesions are produced is called the pathogenesis. Patho means disease, genesis means the causing. So the mechanism by which the lesions or mechanism by which the disease are produced, it's known as the pathogenesis. Sign and symptoms. The functional implication of the lesions felt by a patient are symptoms, and those discovered by the clinician are the physical sign and symptoms. Means if you are suffering from the typhoid, then the sign and symptoms are abdominal pain, high grade fever, then hepatomegaly, splenomegaly. If you are suffering from the pneumonia, cold, fever, difficulty in breathing, these are the sign and symptoms of the disease. Diagnosis means the final conclusion arrived with the help of the sign and symptoms. Means on the basis of the sign and symptoms and other investigational parameter. For an example, like if there is a typhoid, then the diagnostic parameter is the Vidal test. A person suffering from the pneumonia, then the diagnostic parameter is the chest x-ray as well as the blood test. If the person suffering from the TB, then it is the tuberculin test. So these are the diagnostic tests from which we can conclude the name of disease. Prognosis. Prognosis matlab the forecast of the outcomes of the disease. Means what care should be taken after the treatment, what going next after the treatment, that is known as the prognosis. And the treatment means it's a treat the disease by using certain drugs. Prevention means to prevent the disease instead of treat. Like for example, AIDS, we all know that in AIDS the prevention is better than the cure. So what are the preventive measures for the AIDS? So by using various contraceptive device like condoms during the sexual intercourse, then avoid the sexual intercourse for multiple partners, then to avoid the uh, take the blood from the professional blood donor, as well as use and throw needle, disposable needle. Okay, these all are the preventive measures in the AIDS. Okay, so now the next point is homeostasis. What is homeostasis? That is the internal equilibrium of the human body is known as the homeostasis. For example, here I will represent the blood glucose level. So we all know that the normal blood glucose level in our body is fasting is 70 to 90 milligram per deciliter, and after meal means it is after means ppbs it is around 80 to 120 milligram per deciliter. Okay, so there are two hormones which is responsible for the regulation of the blood sugar level in our body. Okay, and these hormones are released from the pancreas. And what are these hormones? So these hormones are glucagon and insulin. These are the glucagon and insulin. Now what is glucagon and from where the glucagon is released? The glucagon is released from the alpha cell of pancreas and insulin is released from the beta cell of the pancreas. Now what is the role of glucagon? The glucagon is increase the blood sugar level. When you are in fasting condition, your blood glucose level is fall, the alpha cell of the pancreas is release the glucagon, and that glucagon increase the blood sugar level by this four way, increase the glycogen breakdown, means the glycogen breakdown and convert into glucose. Second point is gluconeogenesis in liver. Gluconeogenesis means the synthesis of glucose other than the carbohydrate source, for an example like lactic acid and amino acid, convert into the glucose. Inhibit the glucose uptake by the cell means reduce the uptake of glucose and thereby blood sugar level will be increased. Inhibit the glycolysis means decrease the breakdown of glycolysis and thereby increase the blood sugar level. Once your blood sugar level is rise, okay, or after meal your sugar level is rise, so insulin is released from the beta cell of the pancreas, and that insulin is decrease your blood sugar level by decrease the glycogen breakdown and inhibit the gluconeogenesis, means the glucose formation will be decreased, increase the glucose uptake by the cell and increase the glycolysis, means increase the glucose breakdown and generate the ATP. So with the help of these two hormone glucagon and pancreas insulin, which is responsible for maintain the blood glucose level in our body, so that is known as the homeostasis. Okay, there are certain other hormone which is responsible for the other component, like for example parathyroid hormone and calcitonin is regulate the calcium level in the blood. Okay, so this is also kind of homeostasis condition. Okay, now the feedback mechanism. So what is feedback mechanism? Always there are two type of feedback mechanism, positive and negative feedback mechanism. So here I will take the example of blood pressure in the feedback mechanism. So we all know that what is blood pressure? Blood pressure is the pressure exerted by blood on the blood vessels is known as the blood pressure. Now, when your blood pressure get fall, means when your blood pressure is decreased, the renin is released from the juxtaglomerular cell of the kidney, and that is called the positive feedback mechanism. Now this renin act on the angiotensinogen, and from where this angiotensinogen is released from the liver. This angiotensinogen in presence of renin is converted into angiotensin 1, and this angiotensin 1 with the help of angiotensin converting enzymes secreted or released from the lungs convert into angiotensin 2, and this angiotensin 2 increase your blood pressure by three way: direct vasoconstriction, means your blood vessels get contracted and it increase the blood pressure, increase the aldosterone release, and we all know that aldosterone is the which type of hormone? Antidiuretic hormone, which is responsible for increase the reabsorption of water and the sodium from the distal convoluted tubules. So when the aldosterone is increase the reabsorption of water and sodium, what happen? The blood volume is increased and leads to increase the blood pressure. Hypertrophy and hyperplasia is also responsible for increase the blood pressure. Whenever the blood pressure is increased, it gives message to juxtaglomerular cell and it decrease the release of renin, that is known as the negative feedback mechanism. So when your blood pressure decrease, renin is released, that is called positive feedback mechanism. When your blood pressure is increased, the renin release is stopped. That is called the negative feedback mechanisms. Okay, so in a first lecture we will discuss the general terminology of pathophysiology, second homeostasis condition, and the third feedback mechanisms. Okay, if you like this video, so please subscribe our channel Pharma Ignite. It is the one of the best pharma college, LG Institute of Pharmacy start such type of initiation, and this Pharma Ignite channel helps you a lot for your B Pharm curriculum syllabus. Okay, so please like the video, subscribe and share this video. Okay, thank you. Have a good day.